Thank you for joining us for this webinar to discuss some bladder health related issues. My name is Dr. Jay Shakuri Rad. Most of my patients simply call me Dr. Rad, and I'm a urological surgeon and serve as the director of robotic surgery at Mon Health Medical Center in Morgantown, West Virginia. Some of you may be watching a recording of this, so thank you for taking the time. This talk is sponsored by Medtronic. I do not receive any additional compensation for this talk, and therefore the opinions voiced here are mine. Let's start our talk today by looking at some background information. Many patients come to see me because of bladder symptoms which have significantly and negatively impacted their quality of life. Quotes like this are fairly common. I was tired of rearranging my schedule around the bathroom. It was always on my mind. I was just too embarrassed to talk to my doctor. Those are very common emotions and topics that patients discuss when they come to us. In our society, we have made our bladder symptoms a taboo type of subject, and because of that, many patients are embarrassed to talk about it. As a matter of fact, over 44% of interviewed patients reported being embarrassed by their symptoms. After this talk, you will hopefully understand that this is a common problem, that you can discuss it freely and openly with your physician. So the title of this talk is Live Without Limits, Achieve Lasting Bladder Control. And I hope that you will see that that's a possibility. Here are the topics that we're going to be talking about. And feel free to ask any questions you may have throughout the presentation if you're watching this live. So OAB, or Overactive Bladder Syndrome, is a very common condition, and it has been estimated that about 1 in 6 adults suffer from this condition. Both men and women are affected by this problem, and you can see from the numbers that OAB may be affecting more people than diabetes, yet we openly talk about diabetes every day. And so we have to change the paradigm somewhat and start talking about this very common condition as well. So a common question is, what is normal and what isn't? Well, urinary, let's go back here. Urinary incontinence at any level is not normal. The main reason why someone should see a physician for their OAB and urinary incontinence is quality of life. If you plan your life around your bladder, then it's time to see a specialist. It's a very simple rule that I have for my patients. And symptoms may be going to the bathroom more than 8 times a day, getting the have to go now feeling and not being able to control it, and even having accidents. Those are things and examples of symptoms that can drastically change your quality of life for the worse. You may wonder how the bladder works. Well, it is a complex interplay between your kidneys, the bladder, and your nervous system. Your kidneys filter fluid in your body and convert it to urine. The urine is transmitted to your bladder where it is stored. And when your bladder fills up to a certain capacity, it signals your brain that it's time to empty so the kidneys can continue to make more fluid. If there's a defect or problem along this pathway, then bladder problems arise, and the symptoms of overactive bladder may present themselves. And what causes bladder control problems? So some of the common reasons for bladder problems are our daily lifestyle habits, such as our diet, medications that we take, surgeries we have had in the past, or in case of women, pregnancy and childbirth. Remember that your bladder is housed in your pelvis, and any problem affecting your pelvis may also affect the bladder. And there are really 3 main bladder problems that we often discuss, and I will review each one of these briefly. I just mentioned that the bladder is a storage container for urine. It expands as it fills up like a balloon. If there's too much pressure on the bladder and the opening of the bladder, we call it the bladder neck, is too weak, then stress incontinence can occur. This is often described as leaking urine when one coughs, laughs, or sneezes. Any strenuous activity like lifting weights can bring this about. And so stress incontinence is very well known, especially amongst women of childbearing age or women who have had children. Then there is the inability to empty the bladder at all, which is called urinary retention. This can occur because of a problem with the muscle or nerves of the bladder, and sometimes a combination of both of those things. This may lead for the need for catheterization of the bladder. And that's why there are catheter commercials on late night TV, because the problem is pretty prevalent. And the last of the bladder symptoms that's commonly discussed is overactive bladder, or OAB. OAB is a sensation of urinary urgency that comes about suddenly and cannot be controlled. This may lead to leakage of urine, also referred to as urge urinary incontinence. The urgency also leads to frequency, and some patients describe having to go to the bathroom every hour or so, or 8 or more times a day. And this can be obviously very bothersome, and you have to really schedule your life around your bladder habits and often look for a bathroom nearby. Well, what's the good news? OAB treatments can get you back to living life and enjoy life and not have to schedule everything around your bladder. So what's the pathway here? What do we have to do? Well, the first thing is, of course, we have to start with a diagnosis. There are other conditions that may sound like OAB, but could be much more serious, like bladder cancer. And therefore, it is very important to see a specialist, a urologist, who can properly diagnose your condition. Once the diagnosis has been established, then we start talking about the different options, always starting with the least invasive option. And lifestyle modifications that's the least invasive option. These lifestyle modifications can often play a major role in the treatment of urinary symptoms. We may educate patients on specific dietary changes, exercise regimen, or other things that may help. We may also help you with certain bladder retraining activities, as well as pelvic floor strengthening exercises, often referred to as Kegels. And so this is always a starting point in my clinic with all my patients. Now, what happens if that doesn't work and your symptoms are more severe? Well, if those fail, then we may recommend a trial of some medications. Unfortunately, like most other medications, the medications for OAB can have side effects of their own. These are often dry mouth, dry eyes, constipation, sometimes blurry vision, and sometimes high blood pressure or hypertension, depending on the class of medication that's prescribed. Due to these side effects, as many as 70+% of patients stop using medications after a 6-month trial period. And so if the medications don't work or cause side effects, or the patient does not wish to be on medications any longer, then we may move on to the next option. And these are the advanced therapies. Now, there are 3 advanced therapies that are available and recommended by the American Urologic Association. One is Botox injection into the bladder, and we'll start with exploring that a little bit. Botox is a paralyzing toxin designed to relax any tissue that it is injected into, really. That's why it is injected in the face to get rid of wrinkles, for example, and that's where Botox is most famous for. When it is injected into the bladder, it may alleviate some of the OAB symptoms for a period of about 6 to 9 months, sometimes shorter, depending on the patient. But unfortunately, sometimes it causes too much paralysis, and patients need to be able to catheterize themselves for a few days until the medicine wears off. And that also requires repeat injections because the effects last only a finite amount of time. These injections are often done under some sedation, so it requires a little bit of anesthesia. Sometimes it can be administered in the office, but can be uncomfortable because we have to poke the bladder multiple times to inject this medication. But it is an option nevertheless, and it's considered one of the advanced options. The second option is called PTNM, or peripheral tibial nerve modulation, which consists of patients coming to the office on a weekly basis for up to 12 weeks and spending about half an hour to an hour each time in the office to receive this treatment, which consists of us putting a very tiny needle near a nerve around the ankle and stimulating that nerve with some gentle current. Although this is a minimally invasive treatment, most patients tend to not want to come to the office that frequently. And because the effects can wear off rather quickly, patients tend to shy away from this treatment. But it is a good treatment and it is available. And even though Medtronic makes this device, I'm not a big fan of it because of the patient inconvenience and lack of long-term effects. And so I always counsel patients on the commitment they have to make. And if that's too much for them, then we may move on to one of the other options. Next, and next we have the this picture. Actually, let's go back to it. This picture demonstrates how this is administered. The peripheral tibial nerve modulation is administered. You come to the office, we put your leg up on the table, and we place this tiny electrode next to the nerve that controls your bladder as well. And you go through the program of stimulation for about half an hour. So let's move on to the next treatment modality. Now we have the interstim sacral neuromodulation therapy. This is a therapy that involves placing a small stimulator next to the nerve that controls the bladder and allowing it to normalize the bladder function. We first do a test in the office called the PNE, peripheral nerve evaluation, and if successful, then take you to the procedure room to place a small battery in the buttocks area. That's where the nerves run through. These are your sacral nerves. This battery can often last for anywhere between 5 to 7 years or sometimes longer, and can be easily exchanged through a 10-minute procedure down the road if needed. This therapy has been around for a long time, since the late 90s. And there are different options for the battery as well now. And Medtronic does offer a battery that can last several years, or a battery that can be a rechargeable battery, which is smaller in size, but can be recharged and can last a long time as well. And the rechargeable portion of it usually has to be done about once a week or more, depending on usage. So who is a good candidate? And so this slide discusses the bladder test that we do in the office. The procedure itself takes about 15 to 20 minutes to perform, and patients are usually given a small battery that attaches on the outside via a belt system, and they go home with this for a few days. And over the course of a few days, we ask them how their symptoms are, and if the symptoms are well controlled and they have improvement of greater than 50% compared to what they started with, then this is considered a successful test, and we may move forward with the more permanent solution of placing the battery under the skin. Now, this treatment has proven long-term results, and if successful, can really change a patient's life for the better. There has been 84% satisfaction among the patients who have used it, 3 times greater improvement in quality of life compared to medications, because again, you don't have to remember to take this medicine every day, and you don't have to deal with the side effects of that medicine. 76% of people achieved success with the SNM, sacral neuromodulator, compared to 49% for medications. So that's a big difference, and also very promising. So if you do fail medications or don't like medications, there is another option out there for you. And is this therapy right for you? That's the question. And patients who have OAB, or non-obstructive urinary retention, may benefit from this treatment. It's also been FDA approved for patients who have difficulty with their bowels or fecal incontinence. This is especially beneficial for patients who have failed the other conservative treatments and medications that I discussed earlier. Now, let's see if we can briefly listen to a patient story, which I think is very powerful.
My name is Sarah, and I'm a management consultant, and I'm 28 years old.
Good morning, Sarah. You have some missed calls.
It's a lot of work, and I'm very much engaged in my career and where I'm going, and it's just very exciting right now. When I was about 17, I started noticing more frequency and the urgency coming on, and dealt with it through various forms of antibiotics and just different approaches with diet. And then it got worse and worse. I was really embarrassed when I first joined this company that I had this to deal with, and I actually called it bladderitis. I would get into work and attend a meeting and again be fine sitting down the minute that you stand up. Kind of embarrassing when you've got clients around and you've got to hightail it to the ladies' room. You just always felt like you had to go. It just was not good. It was horrible. So how I was led up to InterStim was through a physician referral that this was the last hope, basically, that I had. And I went in very skeptical, very reluctant, and very closed to this final idea.
The thing I remember most about Sarah is when she came to see me, she was miserable, first of all. She had tried numerous therapies. Everywhere she went, she was being ruled by her bladder symptoms and was controlling her, was affecting her relationships. She is a professional who travels a lot. It was affecting her work. And when I saw her, she was essentially at the end of her rope. The best thing with Sarah that I remember is when I talked to her about the InterStim, she was so skeptical.
I didn't understand why she was so sure that it would work, but given the high percentage rate, I was very open towards the end of our conversation. Given that there was a trial, I was very secure with the fact that it wasn't going to be permanent, that we could have that trial period. My test stimulation period was interesting. It involved a lot of different changes to my settings to try to figure out which one was going to work, and nothing seemed to be doing the trick until the day before the end of my trial, which was a great success for me because it took a little bit of time to settle in. So after the success of the trial, I decided to go ahead and have the second surgery for the implant, and have had no problem since. I love to run and was only really able to run short distances. Any movement to the bladder was just, would set you off with regards to feeling like you had to go to the bathroom. After InterStim, it's like I never had that problem before. I can stay at the gym as long as I want, and I even ran a half marathon just because I didn't have to deal with that anymore. I think of all of the things, I am the most proud of that moment. 2 hours and 28 minutes and 13.1 miles in 20-degree weather. You know, I did it because of InterStim. I don't think I could have done it without it.
All right, so obviously a very powerful video, patient testimonial, and this is not uncommon. This is something that we see and hear about in our offices very often. Patients are able to get back to their normal lives, have a good quality of life, and enjoy the things that they used to without having to worry about where the next bathroom is. And so what's next? I have my contact information here for you, but the most important thing is if you have these symptoms that we discussed today, and this is really affecting your quality of life, then it's time to seek help, find a physician who is able to walk you through the path and through the different steps of the disease process. They have to be able to diagnose you appropriately, offer you the treatment options, and have everything available that you may need. And at Mon Health Medical Center, we have a team that's dedicated to our patients on a daily basis. We monitor your symptoms, we advance you to different therapies as appropriate, and we find a solution at the end that hopefully works for you. And if you're having these symptoms, you can reach out to us. Our phone number is included on the slide. We also, the Mon Health Medical Center website can be used to even make your appointment or request an appointment. And you can also visit my personal website, radroboticsurgery.com, where I have additional information available for patients. And patients can even use the contact page on that site to reach out to me. If you do have any additional questions or concerns, you can also leave us messages at the phone number listed there or on the website. Now, I will take any questions that you may have. And one of the questions is that came up is, how do I know if this will help me? That's a great question. And there's no perfect solution for every patient. We don't use the same solution for every patient. There are multiple solutions available, and we have to explore them and see which one works best for you as an individual person. The symptoms, like I mentioned, can be due to various different reasons. And so we identify those reasons first and then walk you through a pathway. And you will always know where you stand in that pathway so that you know what the next steps may be. And we also try to use multi-modality treatments, so lifestyle modifications. We do the training, the bladder training, the physical exercises. We may add dietary additions or restrictions to the equation. Then we may add medications if appropriate, or we may advance you to the more advanced treatments and decide which one of the advanced treatments is right for you and is going to suit your quality of life. So all of those things can be done once you enter into our program. Great question. So how do we get started? Do I just call and ask for an appointment with you? And that's exactly it. You simply would be are able to call the phone number listed there and request an appointment with Dr. Rad, with me. And you can also do that on the website. If you go on the website and fill out your contact information and request an appointment with me, then our staff will reach out to you and get you started. Not all patients require referrals from their family physicians. If you're self-identifying with these symptoms and you've been dealing with them for a while, then definitely contact us and we can bring you in for a consultation and determine whether or not you're in the right place and if the diagnosis is correct. So I discussed the test, and the other question is, what's that test that you discussed, and what is it like? Will it hurt? Do I have to take off work, and are there restrictions? Those are great questions. So the test that I mentioned for the interstim sacral neurostimulation pathway is called the PNE, peripheral nerve evaluation. It's a test where you come to our office. You're placed on one of our tables, procedure tables, with your facing down, and we numb up your skin and place a small, what's called an electrode near the nerve that controls your bladder. And the procedure takes only about 10-15 minutes usually. And we put some sticky tape on your back and give you a little belt that has a battery in it, and you go home with that. It's a very simple, quick process. After you go home, we monitor your symptoms. We are in touch with you. Our representatives from Medtronic help us, and we contact you. Our nurses may contact you and ask you how your symptoms are doing. And if we see that your symptoms have improved by greater than 50%, then we take out the temporary test that we did in the office and schedule you for the official procedure room or the operating room suite and place the permanent lead and battery or generator in. I show you all the different options for the battery in the office, and so we essentially make a decision on whether you like a rechargeable battery or if you prefer one that you just kind of put in place and don't have to worry about recharging for several years. In terms of taking off work, the actual bladder test doesn't require you to take off work, but you do have to come to the office and spend a few minutes with us. For the procedure itself, for the InterStim procedure, it's the day of the procedure you have to take off. And aside from that, your restrictions are really 1 to 2 days of limited weightlifting, but you can go back to work. We don't, these procedures do not require medications. All of my patients go home on Tylenol, and the risks of the procedure are fairly limited, but I do discuss those in the office as well. All great questions. And if you think of any other additional questions, like I mentioned, feel free to visit our website and enter your questions there, and I will get back to you within a fairly quick time period. Thank you for logging in and spending some time with us, and we hope to see you in the office in the near future.